The lawmakers, by the way, on the Joint Committee just got back from a trip to Portugal last week. That country decriminalized personal drug use about 20 years ago, and Measure 110 here was supposed to be modeled after Portugal's law there. A group of about 25 people from Oregon went to see it for themselves: legislators, law enforcement, and people working in the mental health and addiction recovery field. So we wanted to know how that trip went and what, if anything, they took away from the experience. All of them agreed Portugal put a lot more thought into their decriminalization program than Oregon did. Here's Aaron Schmautz, the president of the Portland Police Association.
In Portugal, it's very clear that the entirety of the government sat down together and said, what do we need to do? How do we need to resolve this problem? There was broad consensus. There was community consensus. They had a multitude of bills. They spent several years ramping up treatment, and they don't have the waiting list. They just, all of it was done very differently. And so when I say that we can't just turn back the clock, my concern about a full repeal is that we would end up just dumping this whole problem back into the laps of the justice system, which really is not the right partner for dealing with addiction itself.
Schmautz was one of the people who went on that trip. He spoke before the Joint Committee in Salem this week as well. He said that the criminal justice system does not have enough police officers, jail space, or public offenders to handle the influx. He told lawmakers he supports getting people to treatment, but that police right now have very few options.
Right now, the only option that police officers have is walking away in jail, and those is just not sufficient. We need to be able to call peers, call in services in real time, 24 hours a day, 7 days a week, and on your mom's birthday, we need to be able to have resources available to police.
Oregon Senator Floyd Przansky, who represents Eugene and some surrounding areas, is also on the Joint Committee and went to the Portugal trip. He says when it comes to recriminalizing, it's worth thinking about, but he's still waiting to learn more.
Clearly, one of the things that we learned in Portugal from the experts there is that recriminalization is not the approach that they would be suggesting for us to do. But at the same time, we have to acknowledge that their laws are structured differently than ours. And so we need to see how we can actually take what we've learned and what has been given to us in Portugal and really transport it into the criminal justice system in the United States, specifically in Oregon.
But there is one big reason, according to PPB's Aaron Schmautz, that trying to translate Portugal's drug laws to Portland is difficult.
Fentanyl is not a thing there. They do not have any fentanyl in their drug market. It appeared that they have some amphetamines. The kind of meth that we have in Portland here is just very, very strong, leads to significant psychosis and mental health issues. And so the drugs of trade there in Portugal are effectively the two that we saw the most: heroin and crack cocaine. Those are things that are present here, but fentanyl has kind of overridden the majority of the drug market in Portland. The cost is also significant in that it's very, very cheap here. In the areas where they had use sites, there was very obvious open air drug dealing going on. A lot of those issues were very similar. But what I saw as far as just the state of people suffering from addiction, I don't know how to say it other than there is a depth to the despair that I see in drug users in Portland that exceeds what I saw there. The fentanyl is a force multiplier beyond anything we've seen here. It's very deadly, and it is very addictive, and it creates dependency issues that exceed anything we've seen. And so that part of it really is a challenge.
Now, there's one more person who went on the Portugal trip that we talked to, Multnomah County Chair Jessica Vega Peterson. She says there are things Oregon can start working on right now.
There were a lot of components, though, of what they had in Portugal that we can bring here that we can use to help people on that path. So it's not just the treatment services, but they do a ton with prevention. Prevention actually looks really different. We spent an afternoon with law enforcement, and they were talking about how they are embedded in schools. And they actually, a big part of the work that this unit does in Portugal is actually going to schools and talk about prevention, not just with drugs, but things like, gender dynamics and radicalization and all of this. So that relationship is different, but it's not dissimilar to what some of our public health folks or some of our community-based organizations are already doing. So how can we amplify that? we were able to see mobile medical clinics and mobile methadone clinics that were going out into the community to helping meet people where they were at, to making sure that they had not just what they needed to help manage their addictions, but also connections to services and other healthcare treatment. So, increasing our crisis mobile response, increasing our mobile medical units, that is definitely something that we can take away.
So what is your take? Yes, we want more comments from you. We love that on this show. Should drug use be recriminalized here in Oregon? Should we repeal 110 entirely? Or is it worth seeing if we can tweak some things to make it better? You know the drill. The email is thestory@kgw.com or call and leave a voicemail, 503-226-5090.